get started. So I'd like to welcome everyone to the first of TRiSS's COVID-related public-facing events. I want to start with a quick note, just that everyone knows the event is being recorded, so we're going to make this available afterwards for people to watch. So just bear that in mind when you're making your contributions, that it will be in the historical archive, however obscurely folded away, it will be there. We have great plans for future talks as well. I'll come back and we'll mention that at the end. If you'd like to find out more about future events around how COVID may change society, do let us know through whatever way. What I'll just do now is I'll introduce each speaker, but I'll introduce each speaker before they talk, just so that it's easier for people to remember who's talking about what. After each of the three talks, we'll have time then for questions and answers, for open discussion for any of the presenters. As I say, we can, if you want to make a contribution from the floor, so to speak, as an attendee, we can do that through audio. Maeve will be able to bump people up to panelists to do that, or if you just want to type a question, I'll be able to put that to the panel. Okay, so without further ado, I'd like to introduce our first speaker is Professor David Hevey. David is the head of the School of Psychology at Trinity. He's going to be discussing his work on our perception of risk to our health. So David, take it away.
Okay, thank you very much, Ronan, and thanks very much to Maeve for setting this up. I'm going to try my share screen and hopefully this will work. Okay, so what I'm going to talk about this afternoon is really issues to do with risk perception in general, based on work I've done previously, but also maybe to talk about some data that's come out just recently about COVID-19. Okay, so when we think about risk perception in relation to health threats, I suppose really what we're looking at are, I suppose, two fundamental questions that we ask ourselves. One is around how likely am I to get some health threat, in this case COVID, and then how bad will it be? So we can think about this in terms of some combination of thinking about the likelihood of some negative event and then how severe it's going to be for us. But we know that risk perception is a very complex process of meaning making. So it's not just this cognitive appraisal of likelihood and severity, but rather risk perception is also influenced by our social context. So it's not just our own experiences. And we know behavior, particularly around COVID, is influenced by how our social network behaves and how it perceives the threat. Particularly when there are times of uncertainty, we look to our social networks for information and guidance. But in addition to the kind of psychological, the social factors of risk perception, there is also a kind of proximal or geographical issue, whereby when we think about the risk being in our own community versus being far away, I mean, it's very obvious from how governments responded that even though we knew this threat was coming, it was still quite geographically distal, and yet we still don't seem to have prepared for it. And Ort has talked about existential risk and talked about this idea that even when we have experts telling us about a significant probability of unprecedented events, we still have great difficulty believing it's actually really going to impact us until it actually physically is present within our environment. So how then do we try to make sense of COVID-19? Well, typically when we have a new risk, what we try to do is anchor our perceptions based on prior experiences to other similar risks in our memories. But what's comparable to COVID-19? The regular seasonal flu, SARS, H1N1, MERS, the Spanish flu. So we have a lot of different potential comparators, but each of those are different in terms of the nature of the illness, in terms of its transmission and its treatment. So we are struck by our availability heuristic, which is where we tend to estimate the likelihood of events based on our ability to recall previous examples of that event. And for something like COVID-19, where again, it was seen as being so rare, we really tend to underweight those events. so ones that are unprecedented or very unlikely. So really what this means is that when we come to think about risk, we can go back to Paul Slovik's seminal work within the mid-80s, where he talks about two different dimensions in relation to risk. One relating to certainty, so whether a risk is known and has immediate consequences, or whether it's kind of an unknown risk and maybe the consequences take a while to develop. We can then combine that with a sense of dread. So whether the risk is uncontrollable, whether it's catastrophic or potentially fatal, how equitable it is. And we can really think about where COVID appears in relation to these axes and look at it as maybe being something that's quite kind of catastrophic, but also quite unknown. So when we think about risk perception, one of the key challenges we have is in relation to how we make sense of risk information. And it can be quite threatening to the self. So although we know that health messages, particularly fear appeals, can produce self-protective behaviors, at times they make us feel threatened, or the fear that we have around them can elicit quite undesirable defensive responses. So some of the common defensive responses that we see are things like attentional avoidance. So again, people just switch off and zone out. It's just every day we're being bombarded with information about COVID, so it's easier just to avoid all of this. And if you avoid it, you don't have to think about it, you don't have to worry about it. But if we can't avoid information, and within the COVID area, it's very hard to avoid it, then what we tend to see are kind of defenses, which may be where people counter-argue against the evidence that's been presented to us about the threat or the action that we need to manage the threat. So again, we can see things where people talk about maybe COVID not being that important, it was just scaremongering, certain politicians maybe saying it's a hoax, or also we can think about how we might try to normalize it. So to then start saying, well, it's just like the regular flu, and therefore we shouldn't have to think about anything differently. One of the particular defensive reactions that I suppose I've been interested in for quite a while has been this idea of comparative or unrealistic optimism. So this is when we ask people to think about health threats, not just in relation to themselves, but also in relation to basically people who are similar to them, their peers, their friends, people the same age, same gender. And what we tend to find is that people tend to be comparatively optimistic about likelihood. So people tend to think that they're less likely to have some sort of negative event compared to their peers. But they also tend to be comparatively optimistic about the severity of negative events. So even if I did develop X, be it cardiovascular disease, be it diabetes, be it COVID, well, maybe it's not going to be as severe for me as it will be for others. So really what this comes down to is a belief that, I suppose, bad things are more likely to happen to others who are similar to me. But even if they do happen to me, they're not going to be as bad for me as they will be for them. Why this is a problem is we know that people who are high on comparative optimism tend to report very low interest in adopting precautionary health behavior. So if you don't think you're at risk or you're at less risk, well, then why should you have to change your behavior? I'm very thankful to Cooper Smith and colleagues in Germany for sharing this data with me. So they've studied comparative optimism in relation to COVID-19. So this is a 3-country study, about 800 participants. And what they do is they ask people to rate their likelihood of getting COVID over particular timelines. So in the next 2 weeks, 2 months, year, or lifetime. But then they ask them to rate, well, how likely is it that someone who's the same as you, same age, same gender, how likely are they to get COVID-19? And what you see is pretty consistent with other studies looking at COVID-19, or sorry, looking at health threats, which is that your rating for yourself is always lower than the rating you have for a typical person. So that's quite common across multiple health areas, and here we see it being replicated with COVID. What they did that was quite interesting was then also asking about, well, if you were to get COVID, how likely is it that you're going to transmit it? And again, what we see is the same optimistic bias. So how likely are you to transmit it? Well, you're less likely than your family, you're less likely than your friends, you're less likely than your colleagues. You're less likely to do it at recreational activities, at leisure travel activities, and commuting. So here we see the same set of beliefs that then sustain a sense that we're at less risk, but again, when things happen, they're not as severe for us. So why are people comparatively optimistic? Again, in relation to likelihood and transmission of COVID, what Cooper Smith and colleagues looked at were a set of beliefs that seemed to relate to levels of comparative optimism. So again, people believe that they themselves were more likely to endorse a belief that reducing physical contact is more necessary. So I take this more seriously than others. Or that it's easier for me to reduce my social contacts relative to other people. I'm going to suffer less than others when I reduce social contact. And I'm going to follow hygiene standards more closely than others. And again, these types of rationale are quite common across pretty much all health threats when we go and look at them. So in previous research we've done around looking at comparative optimism for severity, again, there's different types of reasons. They can be purely motivational. So in order to make us feel better, we think that we're less at risk or that things won't be as bad for us. Alternatively, it could be that this is to do with non-motivational factors. It may just be that we overestimate our own coping abilities and coping resources, or maybe we're underestimating how well other people will do. And it's not really clear from a lot of the comparative optimism literature which of these processes is driving it. So in order to try to make sense of risk, we tend to come back to the trifactor risk model, where we talk about different dimensions influencing risk. So we have deliberative risk. So this is our judgment of probability based on our likelihood beliefs, those probability statistics that we hear. But there's also an affective element to risk. So where we can look at the valence of the risk in terms of whether it's positive or negative, and the level of arousal that it creates for us. So is it high or low? So we may have a very low level of worry or anxiety, or maybe that we're in a state of complete dread about something. There's also the experiential aspect of risk. So again, our susceptibility beliefs, how vivid the images are of COVID-19, our feelings of vulnerability, those kind of gut responses we have, and also the social aspects. And it's very clear from the emerging literature that all three components are influencing our motivation in relation to COVID-19 protection. So I'm just going to finish up with some very hot off the press Irish risk perception data that comes from the COVID-19 psychological survey that's currently running. And again, I really want to thank Frédéric Valliere and colleagues for sharing some of this data with me. So this is based on 1,000 adult citizens who completed a survey on the 31st of March. And again, there's a second wave coming next week. So really what this data show us is that when you look at people's perceptions of who is likely to get seriously ill if they contract COVID-19, again, a lot of the messaging that's come from the media over who's most at risk, be it old people or people with pre-existing conditions, we can see that the general population is really seeing those as being high risk. But we're also seeing pregnant women and children as also having risk. When we look at people's self-beliefs, what we see is that most individuals who've been surveyed were reporting, about slightly below midpoint level of risk for themselves for both the next month, the next 3 months, or next 6 months. And that's relatively stable. Now, hopefully, Frédéric and colleagues will have more data in the next few weeks that will really give us a good sense about how maybe some of these beliefs are changing over time. But just to finish up, I think with risk management, COVID's highlighted a number of fundamental challenges for us, or things that are different. So typically in relation to health risk, it's normally the state is just educating people about health risks, and then individuals are left to self-regulate. So the government tells you, or you get health warnings around what you should or shouldn't do, and you decide yourself. With COVID-19, this is quite different. We have a state that's both educating and regulating, and also requiring individuals to self-regulate. The other issue that's different in relation to COVID-19 and risk is that it's not just about a risk to self, but also it's about our risk to others. So a lot of the communication has been about how our behavior diminishes the risk for other people. So I think kind of COVID-19 research on risk is really going to have to push into new areas, because quite often a lot of our research hasn't considered these aspects of risk perception. We've done a lot about self-risk, but this idea of you being a risk to others really hasn't been studied to the same extent. So hopefully COVID-19 will give us some opportunities to start to test some of our models to see how that holds up. Okay, so thank you very much.
That's fantastic. Thanks so much, David, for that really interesting stuff there. And as you say, some of it really hot off the presses too. So we're really grateful for that overview. Next up, we have Professor Richard Layte, who is head of the Department of Sociology at Trinity. He's worked a lot on socioeconomic inequalities and mortality differentials in Ireland. He'll be presenting today work on the effects of recession on children's health and well-being, some lessons from Ireland's last crisis not so long ago.
Great. Hello, everyone, and thanks for coming along today. And thank you very much to Maeve and Ronan in TRiSS for organising this event. Let me just share my screen and bring up some slides so we can see this. So hopefully everybody can see these. Let's go back to the beginning. Okay, so I'm going to take a bit of a different approach to well, definitely from David, to looking at the effects of the COVID-19 and the effects of the subsequent recession that it might bring on the population, but particularly on children. And some lessons we might be able to learn from Ireland's fiscal crisis.
Sorry, Richard, I don't know if you have your slides up yet. I don't know if you're sharing your screen. I just can't see them at the moment. I don't know if anyone else can.
Response. So
Has Richard frozen for anyone else?
Same here, Ronan.
Apologies about that. That's one of the limitations, I guess, of an online platform. But we're working to get Richard back up and running. Now, would you mind if you jumped in and stepped into the breach at short notice? So I'll do a third introduction very quickly after the second. And we'll work to get Richard back up online. Professor Nafu is in the business school at Trinity. She's an expert and associate professor there, and she's director for the MSc in Human Resource Management. That's her area of expertise. She will be discussing navigating paradoxes in work and life during COVID-19. Thanks very much, Naf, for coming along today.
Thank you very much, Ronan, for the lovely introduction. And good afternoon, everybody. I would like to share my screen and start my presentation, and while waiting for Richard. It's great, Ronan, maybe I jump first so that people can I get my boring part first, and then Richard's more inspirational part at last. So anyway, great. My topic is navigating paradoxes in people, life, and organizations during this COVID-19. So my presentation is based on my own research and also my interactions with practitioners during the past few weeks, where I organized a weekly virtual cafe with students, staff members, and a lot of organizations from outside Trinity. So I would like to share some, very fresh data and describe what's been happening to everybody. And I will make my presentation as general as possible so we can relate to ourselves, and also welcome any comments, suggestions, and how we can work together to cope with this crisis. So there's a lot of research in the management in business about change, about managing crisis. And overall, I personally like a very simple structure. So process towards change in general, particularly for this crisis, as David just mentioned that, we have different reactions. So that's our first step when we hear about the change, and when we hear about the shock, when we hear about the news and everything, right? So the first one is the reaction part. After the reaction part and how we feel, and then we respond, using our own behaviors. As David said, sometimes you say, okay, I don't care, I switch off. Or some people may say, okay, it's not as important as it was. Let's see what people say, you know, how they responded. And the last stage will be recovering. You know, how could we reflect? I know, you know, people have probably still in shock, but, you know, we need some space and some time, which can be provided by yourself or by your boss or manager or by our organization to have some space to reflect how we can do better. So my talk is going to show some data based on the reactions, responding to this change and recovering from the change, and using the data I collected from different participants. And yes, and let's say talk about the reaction. So I have two groups, and also, you know, I would like to thank all of the people who joined the virtual cafe and the support. It's not a study; it's really getting together to share something we have in common and help each other. You can see from the first group, and I ask about, this is a well-established scale called panels. So it's a positive affect, negative affect. What I want to show is that actually during this COVID-19, during this crisis, everybody has a mixed feelings. Because in most research we have done it before, either people pick up a positive or negative. But here, people actually pick up a mixed, very mixed. You can see very actually evenly mixed. We have interested, inspired, excited, you know, strong, enthusiastic. And we also have a negative, you can see scared, upset, distressed, nervous, afraid. So they are actually evenly 50-50%. It's very, I mean, it's very surprising to say this kind of a mixed feelings in practice because it hasn't been seen in research. This is one, and the second group shares similar mixed feelings as well. So we have, you know, not half overly a little bit more positive. So what we say is that it's very, you know, people's feelings are not stable. You know, sometimes you probably feel the same. One day you feel very strong, the next day you hear some news and then you just feel down. That's completely normal. And then we ask about the challenges. What challenges are you facing? And, you know, so we have people from private sectors. You can see from here, consistently, people say feel lack of motivation, uncertainty, disconnection, emotional, and feel emotional. And all of the other words you can see, you know, workload. So I think this is from a group, but I think it can be applied to everybody. You know, loneliness, burnout, and but some people feel positive, like say freedom, and they say daily structure. So we have to have a daily structure. And but again, it also indicator about unstable feelings. You know, people also, you can see they face a variety of different challenges. If we look at the public sector, and you know, I don't say the sample size. Actually, the sample size here is smaller than the other one, but you can see the more input from people. They talk about uncertainty, time management, work-life balance, isolation, health. But on the edge of the circle, you can see there are a lot of different challenges. Even the variety here is more than the variety in the public sector. So this is the reaction stage. People are facing or having or experiencing completely mixed feelings. And people also have a variety of challenges. Does that sound very familiar, or does that sound very strange to you? The next stage, let's move on. How do we respond? And people have different strategies to respond. And people, and David talked about it from psychology. Richard going to talk about, you know, how we respond, how children responded, and probably from a sociology perspective. So from my perspective and from the participants, we use some common measures about team management. You know, how about the trust and building in the teams? As you know, everybody is working online, remotely. And so I want to look at, I ask participants that what are the changes you have found? Is that those team measurements are much stronger or much weaker? So you can see that actually for team trust, is slightly, you know, more stronger. But if you look at the next one about feel close to colleagues, because of no socialization is weaker. I felt a sense of caring for each other, very, very strong. My work relationship with my manager is effective, no change. And I work to protect my organization from potential problems, again, much stronger. Those, we call them organizational citizenship. So you feel the bonding between yourself and the organization, become stronger. So this is one part how we respond. In more details, how do we respond? And what kind of changes or actions and have we taken to protect ourselves, to protect teams and organizations? Some people say more efficient, some people say, okay, not productive. Some people say communication is the key. I'm going to emphasize a few times about communication. Some people, felt, isolation, and some people say, and keeping the space. I think one participant mentioned that one day we did a conference call. Actually, we only realized one of the team members actually is sharing apartment with the other two people who are also working. So you can imagine 3 people sitting in the sofa. Everybody has their own conference calls. Imagine that. And working closer together. Again, people have different ways to respond to this crisis. Let's have a look at recovery. Take a step back and reflect on how we can do things better, even in this very, very constrained and pressurized environment. How could we do things a little bit better? In our research, business research, we focus on a lot. You talk about marketing, you talk about operation, you talk about team management, you talk about human resource management, you talk about process. And one thing we keep talking is about the leadership. How could we have a great leadership in crisis? In this crisis, as David mentioned, that we care about, the health, the risk, the threat, ourselves. And I believe, based on the numbers, the death tolls, the infected people, I'm sure, you will hear, maybe yourself or maybe your friends or your colleagues, their friends or their families got infected, or maybe have not, great news and tragic things happen. And in this case, what kind of leadership do we need? We need people who have compassion and who also need to get things done. Because leaders, they are in the middle between organizations, or they are also the linkage between organizations and individuals. From organization perspective, a lot of organizations have been deeply affected by this crisis, reduced the revenue and lost the market share. And just, some company may lose millions every day. In that case, managers have to take the responsibility, get things done and get work done. But on the other hand, remember we talk about mixed feelings, different challenges, and people have to get things done, but also need to care about our own well-being. So in this pie chart, we ask people that during this crisis, what kind of manager do you have? So a lot of 44% people mentioned that they have very productive, but not very compassionate leaders. And we have the second last is that 31% is both, they can get things done, but they do share that compassion with us. And also 19% said, one-fifth said very compassionate, but not very productive. Okay, we do have some small percentage not doing great job. So this is the leadership we are having now. And then let us think, what kind of leadership do we need? So we have, then this is a key words from participants that we need people, we need leaders who can understand what we do, how we feel, and how we can do together. We need good listeners. And we also, they say aware of the mood, because you do feel sometimes in a group meeting, although there is a lot of social, let's say, how are you doing? But the feeling, the distance between the participants, the team members and the team leaders, cannot be really closed by those social greetings. You have to be aware of the mood. Active learner, self-aware, can see the big picture, flexible, constantly communicate. Again, it's not surprising that the leadership we need, even not in a crisis, but they are just more and more important, extremely important in this crisis. Coming back to the we said react, respond, and recover. So this is been shared on the social media a lot. You probably have seen this. So we have this kind of fear zone, similar to the reactions. You know, I feel good, I feel bad, I complain, I just switch off, I feel mad, I feel angry. And then going to, after this phase, people respond. Either switch off, completely give up, I just don't care anymore. But a lot of people will take, you know, more positive actions, you know, identify my emotion and join different activities, webinars, like here, we join different things to learn from each other. And after this zone, how could we move everybody to the growth zone? You know, you think of others, think about yourself, and make people, you know, can work things better than we used to. This week would be next week is going to be the 8th week. So this week we are still at the end of week 7 lockdown. And I believe a lot of people like myself, you know, have young children or have different family responsibilities. So after week from week, we are more used to work with partners, with children, with families on different arrangements. And so we are already in the learning zone. The next step is how do we go to the growth zone? That's the topic task for everybody. Share something about my own personal view. Looking forward, we as individuals, and I talked to this at the Trinity Cafe, is that the first one we need to build is the self-resilience. Only when we are resilient, strong, we can pass that on to the people around us. The first thing is not to encourage you to do everything, to keep up with everything. I do have colleagues who write emails and reply emails during, you know, outside working hours. And personally, I also do the same. But if you need some space, do pause. Don't try to finish everything immediately. Don't try to catch up with everything. You know, emails, sometimes if there are some unread emails, complete fine. Pause. Talk it out. Go into different webinars. Trinity runs this every, I think 1 o'clock meditation for half an hour, mindfulness. If you want to talk to somebody, go and talk to your friends, talk to your colleagues, and people are very open this stage. You know, you say, oh, I don't want to bother that person. You know, they already have a lot on their plate, but don't worry. You know, if even we are busy, I think everybody will take a few minutes to listen to other people. The third step for building resilience is very, very simple. Just kick yourself out. Once you start working on emails, on your class preparations, on your whatever you do, you are immersed in your work, and you really have to kick yourself out. When the sun is out, go out. You are not just going out to be there. Be present in outside. Notice the color around you. Notice the sound around you. Notice the pattern around you. You never noticed before. So enjoy that presence being outside. So this is 3 steps as we are as individuals: pause, talk, and go out. Look forward, we as leaders.
2 or 3 minutes just to finish.
Okay, I'm going to finish very soon. Thank you, Ronan. And going out, and is that the last one? Looking forward, we as leaders. In this process, if you are in a leading position, and research has already shown that directive leadership is the most effective leadership in crisis. You understand expectations and provide very clear instructions. This time is not a time for empowerment. You know, you give people autonomy to do things. This time need clear instructions. We call out for directive leadership. We also call out for directive followership. If you are a follower, if you have a manager ask you to do something, is that something that you can't do? Just speak it out. You can't do that. Okay, so be directive, be adaptive. I don't need to repeat that. Be adaptive. Something worked even yesterday, probably not going to work today or tomorrow. Be adaptive. We as organizations, we need to construct a strategic review based on the how could we innovate what we are doing? And a lot of private companies and also I think public sector really need to think about the cash flow, scenario-based planning, and think about the new ways of working, enable lifelong learning, and all of very important. But the top priorities for organizations is listening, communication, and visibility. My last slide for my talk is about the navigating of paradoxes. We talk about the paradoxes. It's between individuals, teams, and between focus, variety, between clarity, ambiguity, and caring for individuals or caring for business. You have short-term and long-term action values. And how do we learn from the past? How do we balance that from looking forward to the future? I don't have the answers, but we can discuss. I promise this is the last very few slides I'm going to through. This is the virtual cafe I'm organizing for everybody, and everybody is welcome. I'm going to put that link in the chat box, and we have focus on change, and then we focus on helping each other, and we also have a topic on sustainability. We have the last session is we're going to talk about the living life and death, life and the living. So I'm sorry for running a bit over time, and really feel really great to share this with everybody, and I love to the discussion. Back to you, Ronan.
No, thanks very much for a really interesting presentation and lots to think about going forward. So we have Richard back, so hopefully second time round lucky. Richard, if you want to share your slides there, and then we can go from there.
Yeah, apologies for that. Everything was stable and I had great connection until I started talking, I think, and then it just went straight away. So let's hope it doesn't do exactly the same thing again, all right, as soon as I start again. So I'm just going to try to share my slides now, if I can. Okay, so hopefully everyone can see those. So I'm going to take a bit of a different tack. I want to talk about some of the...
Sorry, do you want to try once more? You see, is it the green share screen button at the bottom?
Yeah. Can you see those?
Not yet, no.
Not coming through? Okay, hang on a sec. Let me just bring this up. That. Share screen.
Oh, like
what about now? Nothing?
You have two screens maybe, is there?
No, I've only got one screen. I'm on a laptop.
Okay.
Let me just... I think I know what's going on.
Okay, there we go, I think.
You see it now?
Yeah, perfect. Thanks so much for your patience.
Okay. Sorry about this. First time webinar user, rookie errors. So I'm going to take a bit of a different approach to this to the other speakers. I want to talk about some of the consequences of COVID-19 in terms of child well-being, and some conclusions or implications we might want to draw from this about the approach that we might have about these effects, given our experiences during Ireland's fiscal crisis. Okay, so most people are not going to need me to tell them too much about the consequences that the COVID-19 has had on the economy in terms of large-scale closings of organisations and people losing their jobs, such that we've got a large proportion of the labour force now who are dependent on benefits. This picture up now is actually the Intrio office on Cork Street, not very far from my house, where there have been queues of people queuing up to sign on for benefits. It's going to have a dramatic effect on the economy, and it's very much similar to the effect that the fiscal crisis had in Ireland and in other countries in 2008, through from 2008 to about 2013. Except now, of course, the effects of COVID-19 are going to be more widespread. They're going to be affecting other countries just as much as they're affecting Ireland. So some of the escape valve, which we had previously of people migrating, won't be available this time. So the effects can be very dramatic. And as you can see in this chart here, as we saw in 2008-9, you get a dramatic shock to the economy. You see a a rapid escalation in unemployment and a fall off in the same way with incomes, both nationally and individually within the economy. And this, of course, can have dramatic impacts on well-being in the population. So these are some measures of lifestyle deprivation that the CSO published from EU Silk. And as you can see, in Ireland, because of various factors, we have high rates of child poverty. And those rates of child poverty really accelerated during the last recession, largely because government was pulling back in terms of the social welfare effort that was being made because of the financial crisis, because revenues had dropped, so there were lower levels of taxation whilst expenditures were rising. So this led to sharp increases in the experiences of deprivation in the economy and in households, and that was very dramatic in terms of its effects. And it particularly led to a surge in the experience of poverty and deprivation, which we know to be quite toxic toward child well-being. Here's a little slide using some data from the Millennium Cohort, which is a data set that I use on a regular basis. And it just shows you the dose-response relationship between exposure to poverty over a 6-year time frame and certain mental health and physical health outcomes. Here, we're looking at chronic disease, obesity, experience of obesity, and child's social and emotional problems. And you can see that all of those have a relationship to the experience of poverty. So thinking ahead to the effects that public policy may have on outcomes for children is really important, and how we might alter public policy responses to try to improve outcomes for children. We seem to be taking a different approach this time compared to last. But I just want to, in terms of in supporting household incomes with the extension of the COVID-19 benefits, but I just want to share with you some of the results that we had from growing up in Ireland, which is a longitudinal study of children, which is ongoing, which follows children, well, households and children through time, allowing us to see how child environment and the household circumstances relate to outcomes for the children. And one of the really fascinating and useful aspects about growing up in Ireland is the fact that we have 2 cohorts of children, one that we started seeing at age 9 months and another at 9 years, that we have measurement points both before, during, and after the Great Recession. So we could follow up what happened to children during the recession and look at the specific processes that may have contributed to worse outcomes or better outcomes for children. And what I want to do is I want to walk through with you some of those effects that there were on households to show you what mechanisms occur. And I particularly want to focus here on what I'm going to call the family stress model. So first of all then, what did happen to household deprivation during the financial crisis? What this slide shows you is that it was quite a heavy impact on households. So about 2/3 of households experienced a reduction in incomes. Most households were seeing reductions in either social welfare or in salaries and incomes coming into the household. And of course, that had a really massive effect on living standards. Around about 1/3 of people were cutting back on basics during this time, not being able to buy the kind of foods and clothes that they required. They were dropping behind on utilities and mortgage. And these were having really pronounced effects, not only on the living standards of households, but also in terms of the psychological environment that households were in, that parents were under a great deal of economic strain at this point. And this brings me to, in a sense, the mechanisms and processes that mediated between the exposure to recession and outcomes for children. Because I want to show you the family stress model, which has become to be used really since the 1960s, but particularly since the recessions of the 1980s, to explain how economic recession and economic strain impact on families. As you can see here, okay, as we move from left to right, what we see are the translation of economic strain into a psychosocial pressure that ultimately has an impact on child mental health, and as I'm going to show you, also physical health. So on the left-hand side, you can see that the families are often, during recession, they're exposed to economic strain. It's going to vary across households. It's going to be related to, of course, the vulnerability of those households toward the things of job loss and falls in income. But when households do experience this, what you tend to then see is a rise in economic strain on the parents. And that has a direct impact on maternal and paternal mental health. We see higher rates of depression, higher rates of psychological distress. And this can have an impact both on the relationships between the parents. You tend to see more conflict. You tend to see more in the way of interpersonal problems and the sort of decline in relationship quality. But also then an impact on parenting that parents provide to children. You see a decline in the warmth that they are giving to children. You're seeing an increase in levels of hostility towards children. Their parenting becomes much more kind of inconsistent. And this can have real impacts on child mental health. And we can see this happening in the data from growing up in Ireland. So if we look at data from the studies between the first waves and the second waves, I want to show you just some data here about the effect of economic strain on the experience of parental depression, both for mothers and fathers. So we're measuring this using a measure called CESD, for the Centre of Epidemiological Studies Depression Indices. And this is a sort of a measure that can be used to see whether people are experiencing clinically significant levels of depression. And what you can see here, what this chart's showing you, is that as you move from left to right, what you're seeing is the change in the amount of economic strain that the households are experiencing. Okay, so the more to the right you are, the more economic strain they're experiencing. And then on the vertical axis, you're looking at the extent of depression. And what you can see is that there's a clear relationship. As economic strain increases, both for mothers and for fathers, we see a reaction in terms of their experience of depression. Now, you tend to see a greater response for mothers compared to fathers, but nonetheless, amongst both mothers and fathers, we see significant increases in the experience of clinically important levels of depression. So the first part there of our family stress model, we see being mapped out quite importantly. Here's psychosocial stress that the parents are experiencing as well. You can see, again, in terms of the relationship between parenting stress and the quality of the parents' relationship, there's a very strong relationship statistically. This analysis here is adjusting for a lot of other factors, okay? And the sort of selection processes that selected some households to be more likely to experience economic strain than others. But we can still see that even after we control for all those things, the parents experiencing more in the way of stress due to that economic strain tended to have worse relationships with their partners, measured here in terms of the dyadic adjustment scale, which is an important scale for measuring the quality of the relationship between partners. So both mothers and fathers are reporting worse relationships here for their partners, with their partners. Now, lastly, these dual processes of a decline in parental mental health, increases in parental psychosocial strain, and then the worse parenting leads to this impacts on young people, children, in terms of their own mental well-being and psychological adjustment. So here I'm showing you a very similar slide again, but this time what we're looking at is the impact of economic strain on the child's psychological difficulties, okay, measured in terms of the strength and difficulties questionnaire. The reason why there's 3 lines here is that we're looking at 3 different scales. One is about conduct disorder, one is about emotionality, and the last one is about hyperactivity. But you can see for all of those scales, what we see is a worsening of the scale, they're going down, when we see more economic strain in the households. Okay, so when we see more economic strain, we see worse psychological well-being for young people and children. So our models show us that the experience of the uncertainty and the experience of the economic strain in households has a very important impact on children's outcomes. And this is related, if we think about this in terms of interventions, we have to see that government policy here and support of household incomes is going to be really important in setting the context for children. The impacts were not only in terms of their psychological well-being, we also had important health outcomes in terms of physical health. I'm particularly looking at here in terms of chronic disease, but particularly within growing up in Ireland, the experience of respiratory diseases like asthma, but also skin diseases like eczema. And what we see using what we refer to as fixed effects models over time is that households that were experiencing more recession effects in terms of their drops in income, their ability to make ends meet, father, mother unemployment, what we see is a significant growth in the experience of chronic asthma and eczema in those households. Here in this slide, you're seeing it's related to father losing job, but we also see it in terms of the effects of households losing, being able to afford those basic necessities. So the effects were not only in terms of mental well-being and the child's psychological adjustment, and of course the parental psychological well-being, but also in terms of child physical health. Now, these are all really important consequences, but you could make the argument, I think, that, well, maybe once the recession had finished and household incomes recovered, maybe this would lead to these symptoms, these consequences then disappearing, no longer being important. But actually, many of these processes are going to lead to long-term impacts, not only in terms of the effects, the longer-term effects of psychological or physical well-being, but also in terms of missed opportunities for children. For example, when we do the analyses, what we see is that the young people whose households experienced more economic strain, where parents experienced a drop in mental health, were also less likely or did worse in their junior certificate examinations in the subsequent period. And you can see that in this slide here. So we see a significant relationship between the experience of economic strain, the experience of recession, and the points, if we can think of it like that, that the young person achieved at the junior certificate around the age of 15, 16. They'll never get these points back. Okay, so they've experienced, in a sense, a shock, not only to their mental and physical health, but also to their long-term well-being in terms of their educational development. The drop in points here is a significant one that might lead to a different trajectory in terms of their educational development, that might itself be amplified by some of those psychological characteristics that I showed you before. Okay, so given what I've been saying about the effects of recession on families and the effects of austerity on incomes and therefore the effects that that would have on children's well-being, what conclusions could we draw? What implications might we draw out here in terms of the response that government should have to the current crisis, to COVID-19? Well, I think the primary implication has got to be that governments need to make sure that they maintain the living standards of families here in a way that didn't happen the last time around. You've got to see in terms of trying to maintain the incomes of households and not have sort of a cliff that incomes fall off that leads to not only impacts on living standards, but also in terms of this uncertainty and in terms of the psychological stress that households experience, because it's that we see as having a really profound effect on households and is really toxic to parenting. We have to look at trying to make sure that income supplementation is effective at reducing these adverse experiences. The second main point here is that prevention is really much cheaper are much more effective than later amelioration. Okay, so making investments now, trying to find the resources both through internal and external sources of revenue for government and supporting living standards of families will lead to not only better outcomes, but be cheaper in the longer run in terms of trying to deal with the consequences of recession for Ireland. Now, I like to think that we have actually learned some of these lessons, and the response of government so far during this recession has been really, I think, much more enlightened. And it's been important, I think, that a lot of the economic commentary that there has been on the effect of COVID-19 has supported the idea that government should be trying to maintain living standards and to not use the kind of austerity policies that were there last time. But we're not out of the woods yet. So I think these are lessons the government needs to make sure that we put into effect. And it's important, I suppose, as well here to underline that we have such good data from the last fiscal crisis, and that we know about the processes now in households and how we can intervene to try to disrupt them so that we have better outcomes. Okay, thanks very much for listening.
Thanks very much, Richard. It's kind of one of those counterintuitive things that we have so many crises on such a regular basis in Ireland. Hopefully it gives us some good data for the next one. We lost a couple of minutes obviously during the session, so we might take a couple of minutes on at the end to allow people to ask questions. Just to remind you, there's 3 ways of asking questions. You can raise your hand if you click at the bottom. If you click on participants, you should be able to raise your hand, and we'll come to you if you have a question to ask. If that option is not available to you, because everyone ends up seeing these slightly differently, you can, if you're an attendee, you can ask a question in the Q&A. Again, you'll see a menu in the bottom beside participants. You have Q&A. You can ask a question there directed to one or more of the presenters. Or if that's not working for you or confusing, you can use the chat. So again, in the menu on the bottom after Q&A, there's chat, and we'll get to them that way. It does take a little bit of time to write a question. So what I might do is I might just get the ball rolling, allow people to get their questions and send them through. If I could ask a question for David and one for Richard. So for David, I was really interested in the idea of kind of comparative or realistic optimism. But then I started wondering whether there are clusters of people, so that maybe on average people are unrealistically optimistic, but maybe if you were to come up with 3 or 4 clusters of types of people, there's going to be a bunch of pessimists in there and then a bunch of real optimists. I know you're unmuted and Richard's not, so maybe I'll ask my question to Richard as well, and we can do them in reverse order. Richard, I was kind of curious in when you're presenting whether poverty shocks have a different effect on households by their original income level. So whether you could imagine this going either way, so that the originally richer households maybe are more resilient in some unobserved way, or maybe if you're originally richer and you get a poverty shock, this is more alien and actually has a bigger effect. I don't know if that's covered in the research or possible to cover in the research, but it was one thing that came to me. So hopefully you both get a chance to answer that, and we've given some time for people to ask questions as well.
So shall I answer that one first?
Yeah, please do.
So it's a good point you make there about whether the effect of a poverty or of a recession depends upon the living standards and the incomes of households prior to the recession. Of course, what is important here in some respects is the shock itself, the contrast between the flows of resources into the household prior to the recession and that during the recession, and the impact that has. Okay, so households that had higher incomes prior to recession, although you would imagine that would have then buffered them when the recession hit, that they would have had savings. That may have been true in some respects, but what we see in the data is that actually many quite high income households then not only suffered big impacts in terms of reduction in their incomes, but then it had very large shocks in terms of the impact of economic strain. So some of the biggest changes that we see in terms of experience of economic strain are indeed in the higher income households. Okay, and what's amazing about the Growing Up in Ireland data is it allows us, of course, to follow individual families through time. And what we have in some respects, if you think about it this way, is almost like a natural experiment in terms of the effect of recession, in that you had households here that were, prior to this, actually very advantaged, quite insulated from hardship, they had good educations, they had high incomes. But then this, what economists and sociologists would call an exogenous shock, occurs in the wider economy. And this then has a dramatic effect on the household. So in a sense, we have this ability to look at, we can sort of factor out the selection effect that there might be quite often for the relationship between low income and outcomes, and see that, and what we see in the data is that those households that were formerly very advantaged, okay, even those very advantaged, very educated, high income families, when resources are low, and when importantly psychological economic strain increases, their parenting gets worse at just the same rates as families that had a lower income prior to this. And their prior incomes don't insulate them from the effects of being stressed over their now lower incomes. Their higher educations don't insulate them from the effects of recession. So their parenting gets worse. They become more inconsistent in their parenting. They become a lot less warm. There's less hugs for their children. You know, there's more kind of like short tempers, more kind of, you know, sort of reactivity, emotionality with their children. And this has really strong impacts then on their children's experiences. And you see the kind of externalizing behaviors that I showed you evidence of coming through. So to answer your question in a very long-winded way, on one hand, okay, you don't see any differentiation across households by their prior income. Economic strain is economic strain, and if households are feeling it, then it tends to have a negative effect on their parenting. But it also, what we also see here is that the amount of change that happened during the Great Recession was a way of looking at the relationship between income and both physical and psychological well-being of children, that allows us to see that even during the good times, in some respects, some households, these are the mechanisms that are impacting on households. These are mechanisms which are not only occurring during recessions. These occur at other times as well. Even during the good times, some people's incomes fall very quickly. And so it allows us, in a sense, a scientific opportunity to try to get more causality into our analyses. Hopefully that answered the question.
Thanks very much, Richard. It did indeed. David, I don't know if you had any thoughts on my question. I'm still open for any questions from the attendees as well.
No, I'll address the question, Ronan. I mean, I think what you raised is a very important issue about, I suppose, really when we look at the comparative optimism literature, it's really around kind of groups. So you can look at, you know, where you see consistent trends where like the vast majority of a group are believing themselves to be above average. That can't always be the case. Somebody, unfortunately, has to be average, and then there's got to be people who are below average. So within the kind of literature, absolutely, there are people who are comparative pessimists, who then think, you know, things are going to be worse for them. But there's very nice parallel literature on depressive realism. So quite often you get people who are characterized by, you know, a more realistic and a more accurate appraisal of situation that's really associated with kind of almost like the negative psychological traits of kind of maybe being depressed or being anxious, where their perceptions are much more in line with reality. They're not seeing it through the rose-tinted spectacles and overestimating themselves. They have a good grounding. So where we come to look at a lot of kind of trying to align at an individual level, like their own perception of risk and then their actual level of risk, I suppose that's kind of where things get more interesting in terms of almost at a clinical level, where we're then dealing with individuals rather than these kind of population-based tendencies. But the challenge we have with comparative optimism is it's really hard to change. So you can do all sorts of interventions, but it's really, really difficult to shift somebody from that above average perception they have of themselves into even just acknowledging that they might just be average. And that's okay, but there's a bit that kind of, it's actually quite a challenging intervention. But absolutely, this is about, I suppose, again, back to the classic difference between population level group analyses and then when you drill down into individuals. But there are those clusters who are comparatively pessimistic.
Thank you, David. I guess on at one level, human history would be very different if we weren't all slightly too optimistic. You know, it's explorers or settlers or anything like that. Human history might be very different. It looks like everyone on the attendee side is quiet. I know we have gone a little bit over time, so a few people had to sign off. That's okay. So I'll maybe give last few seconds if anyone wants to raise their hand and ask a question. Maeve, I don't know if anyone came through to you with a question, you could just let me know. But if not, I won't.
Yeah, I know. I just, while people may be asking questions, I just want to follow up with Richard and David's comments. I'm not, into psychology, but I would like to add on this shock impact on different groups of people. And from management, perspective, we have this expectancy theory, we have a self-determination theory. So basically, but based on your own education level or working experience or background or family influence, everybody would have a different expectations. In terms of the shock, where Richard found that actually the shock is larger among the groups with relatively high income. This can be seen. These people may already have relative knowledge-based jobs. My research in the professional service firms indicate actually during the recession, the layoffs, redundancies happens a lot in the senior senior level jobs because they are huge cost to the company. So re-employability for those people actually is harder than those people with non-knowledge jobs or entry jobs. So I think that's probably explain why the shock is larger among the high incomes homes. And also, I think the other chance, I want to mention is that different countries have different reactions to this crisis. From employment perspective, now let's say the government is doing a great job, providing this subsidiary a scheme or something like that. But if you look at what Singapore is doing, and so they provide similar welfare, but they do encourage the training for future skills. So it's not just only by giving the money out, but there's a planned, structured training, online training programs available for people to have to get that welfare. So I think I love the prevention rather than taking actions afterwards. So I think the prevention is very important. I think the government and organizations really need to work together to reduce the impact of a recession on everybody, but not just only offering the financial support, but also to think about after this, what kind of key skills do we need as a nation, as a country, and then how organizations and government really can work together to prepare for future needs of skills. I think that will be possible.
Can I come back on that?
Yes, we have actually. We've a question as well, but maybe Richard, if you want to come back on that.
Oh yeah, let me look quickly then, and then we definitely need to get the participants back in. So just in terms of course, households varied in terms of their vulnerability to recession. Okay, so I'd like to just underline that households that formerly had, those households that had lower levels of education, more manual jobs, they were much more likely to experience recession itself, to experience the consequences of recession. So higher income households, they were less vulnerable, but when they were hit, like for example, lots of quantity surveyors and architects within the building industry, they were massively hit by the recession, and that had a big impact on their experience, subsequent experience. On your point now as well about the importance of making sure that we're more proactive and dynamic in terms of trying to manage unemployment, to manage people's skills during recession, this is always very important. The use of what are known as active labour market policy as opposed to passive social welfare is a really important part of the response. Now, Ireland actually traditionally and historically has been quite good on that basis. We've since the 1980s, Ireland has invested more in active labour market policy than many other European countries. We're not quite at Scandinavian levels, but we're not too bad on that front. And I would like to think that that will be the changes that were made after the last recession in terms of our state training organisation, that will really pay off during this one, okay? And there'll be a response, because there's going to be a job of rebuilding that needs to happen after the recession. Many companies are not going to reopen. There's going to be a net loss to employment, a real severe shock, and government is going to have to be part of the solution there in terms of going out there and making sure that the labour force has the skills to be able to, you know, be used in the employment that's left there afterwards. Sorry, I should let the participants ask their question.
Thank you very much to all the panelists there. Camille, I think you had a question you wanted to ask, but you'd raised your hand. So I think if you unmute, the floor is yours.
I was wondering about and apologies, you may have answered this, I came in late. I'm wondering about the particular situation of families in homelessness who have not only suffered generally a fairly severe income shock, but obviously have lost that fundamental security of a home in addition. There's quite a lot of policy focus now on what sort of interventions might be made with parents in those circumstances to enhance their parenting or improve their parenting, develop resilience, etc., etc., etc. I guess to try and mitigate some of those impacts. And I'm wondering whether a GUI or other data, whether are we wasting our time in that regard? Should we really just put the primary focus on trying to make sure that those families get a home again and get an income replaced? Or is there some merit to those kind of interventions? I have to say, were I a parent in homelessness and somebody came along and suggested to me that they would intervene to make me a better parent, I think I might clock them. But I'm interested to hear what the science might say on that.
Yeah. Camilla, thanks for the question. Can I answer that, Ronan?
Sure, please do, Richard.
So we have to see this in terms of a sort of a range of interventions, don't we? On the one hand, clearly households have certain imperatives that they need to satisfy, okay? And having an income which is adequate to their needs, but also having basic requirements like housing are going to be factors that are going to be some of the primary determinants of not only their living standards, but also their psychological state that they're going to be in. Okay, so I think that if we do this from the perspective of intervening to get the biggest effect, the biggest effect is going to be by giving them the right circumstances to parent in, as opposed to intervening on their parenting. Okay, I think what you first of all do is you try to provide adequate housing and you provide adequate income. All right, and you make sure they're in a set of circumstances that are going to allow them to parent before you even think about trying to intervene to improve their parenting. In a sense, the parenting is going to have a marginal effect here relative to the context.
Thank you very much, Richard. I don't know if there were any more questions. There was an anonymous question, but I suspect that was also from Camille. It looks the same to me. Or in any way, it's been answered there. And I think that's both of the questions in the Q&A box as well. So with that, then I might draw today's seminar to a close, given we've gone a little bit over time. Thanks to all those who joined, especially our presenters. Thanks so much for 3 really interesting talks from across the spectrum of social sciences. As I mentioned at the start, we're planning more events. It's clear that COVID-19 is going to change society. And I think today has shown the contribution that social sciences can make to help both the general public and policymakers understand some of those changes, bring the insights from existing research to bear as we think about how to rebuild society looks like going to be a slightly different way, or maybe a very different way. So I'll be working with all of the members, the disciplines that are part of TRiSS. We'll have our first event in a couple of weeks' time with Ed Glazer, who's one of the world's leading urban economists, on whether all this working from home is going to change our preference for living in cities or not. And if that sounds like it might be of interest to you, please do stay in touch with TRiSS, and hopefully we'll see you on our next Zoom in a couple of weeks' time. Thanks everyone for joining, and hope to see you again soon.
Thank you very much, Ronan, Maeve. Thank you, Richard, Dave.
Thank you,
Thank you, everyone.
Thank you all. Bye.
Bye.
Great to talk to you.